We have seen the different function of urinary system. We have seen the different parts of urinary system. Two kidneys are there. We have seen two kidneys. Then we have also seen this part. So I will explain this now. How there is a ultrafiltration. How there is a ultrafiltration occurs in the nephron of kidney. Okay. So suppose that this is your nephron. Suppose that this is your nephron. Okay. And this is known as a glomerulus. Oxygenated blood or arterial blood that is supplied to a nephron by this afferent arteriole. Okay. Afferent arteriole will supply arterial blood to a nephron, and efferent arteriole will take away blood from nephron. Now, if you see carefully over here, so the diameter of afferent arteriole is little bit wide. So diameter of afferent arteriole is little bit wide, and diameter of efferent arteriole is little bit narrow. So due to difference in the diameter of these two arterioles, afferent arteriole and efferent arteriole, so what happens? There is a generation of pressure. Okay, due to difference in the diameter of these arterioles, there is a generation of pressure in the glomerulus, and that pressure is a driving force for filtration. That pressure is a driving force for ultrafiltration. Okay, so whatever blood is there, everything is filtered. Everything is filtered from this glomerulus except plasma proteins and blood cells. So यहाँ पे सब कुछ filter होगा blood cell and plasma proteins छोड़ को blood cell and plasma protein को छोड़ के सब कुछ filter होगा. So everything will be filtered over here except blood cells and plasma proteins. Now everything means your nutrition, your vitamins and all that. Okay, nutrition, vitamins, ions, etc. etc. So सब कुछ filter होगा यहाँ पे. And after that, you know that your body needs nutrition, your body needs sugar, your body needs vitamins, your body needs ions, but everything is filtered over here. So whatever is required, that is taken back again into the blood. So whatever is required, that is reabsorbed into the blood. So selective reabsorption. This one is known as a ultrafiltration. It is known as a selective reabsorption, and whatever is in excess in the blood, so that is again sent to a urine, that is known as an active secretion. Okay, so remember this. Now we'll see again here. So afferent arteriole is having wide diameter. Okay, afferent arteriole, that is an artery which goes towards the glomerulus, and efferent arteriole which is having narrow diameter which goes away from the glomerulus. That is a 20% of cardiac output which is sent to a kidney. The blood is filtered in the capillary network of glomerulus. Okay, everything is filtered except blood cells and plasma proteins. And due to difference in the pressure, due to difference in the pressure, that is the blood pressure between two arteries, difference in the blood pressure due to two arterioles, glomerulus pressure and filtrate pressure. Okay, due to difference in the diameter of arteriole, capillary hydrostatic pressure, that is around 55 mm of Hg or 55 mercury millimeter, which is opposed by osmotic pressure of blood, which is around 30 mercury millimeter, and filtrate pressure is nothing but the 15 mercury millimeter. So net pressure at the glomerulus is around 50 minus 30 plus 15, that is a 10 mercury millimeter. So this 10 mercury millimeter is the known as a pressure responsible for the ultrafiltration. Now volume of filtrate formed in the both kidney per unit minute per unit time. Volume of filtrate formed by both kidney per unit minute per minute or per unit time is nothing but the glomerular filtration rate. Glomerular filtration rate. So GFR, it is around 125 ml per minute, which is normal. Around 90% of filtered blood by kidney is reabsorbed. फॉर एग्जाम्पल जैसे मान लीजिए कि 100 ml ब्लड किडनी ने फिल्टर किया, तो उसमें का जो 100 ml फिल्टर किया उसमें का 98 ml अगेन रीअब्सॉर्ब होता है बॉडी में, एंड ओनली 1 और 2 ml वो उसका यूरिन फॉर्म होता है. सो नियरली 98% ऑफ filtered blood by both kidney, it is reabsorbed into the blood, and only 1 to 1.5 ml is excreted in the urine. So filtration process is auto-regulated and it is in a control of nervous system. Reabsorption occurs, reabsorption of nutrition occurs, okay, and limited amount of nitrogenous waste also occurs. So that's how there is a urine formation in the kidney. Now we'll see the next point, that is nothing but the formation of urine or secretion of urine, that is governed by three processes. That is a glomerular filtration, we have seen this in the last slide. Now selective absorption and active secretion. So what do you mean by selective absorption? Selective absorption means, as I have told you, everything is filtered through a glomerulus. That means nutrition present in the blood, sugar present in the blood, vitamins present in the blood, then ions, various electrolyte present in the blood, they are also filtered, and all these things is required for body. So how body will survive without these things? So there is a selective reabsorption of these things, like selective reabsorption of vitamins, sugars. Okay, we have seen the drug treatment of diabetes. So at that time, I was telling you that there is a okay. So urine formation or urine secretion, both are the same terms, and it involves glomerular filtration, selective reabsorption, and active secretion. These three processes. So urine formation is done in the three process: glomerular filtration, selective reabsorption, and active secretion. So out of that, we have seen the glomerular filtration. In the selective absorption, as I have told you, whatever blood is there except blood cell and plasma proteins, everything is filtered. So that means your nutrition, sugar, vitamins, ions, etc., all are filtered. So and all these things are very important for your body. So body needs these things, and that's why they are selectively reabsorbed into the blood. And active secretion means, if excess is there, if anything is excess in the blood, that will be actively secreted in the lumens of tubules again. Okay. Now what is composition of urine? So urine is made up of 99% water, 2% urea. Now urine is having amber color. It is because of the one pigment known as a bile pigment, known as a urobilin. Urobilin is the bile pigment responsible for the amber color of your urine. This might be a question in various exams. So you have to remember this. Urobilin is the bile pigment present in the urine. Okay. Now what is the specific gravity of urine? It is around 1020 to 1030. That is a specific gravity of urine. And what is the pH of urine? It has already asked 2-3 times the pH of urine. So it is around 4.5 to 8. Okay, it is around 4.5 to 8, the pH of urine. Okay. Now what is normal value of urine? So normally 1 to 1.5 liter ml. Okay, 1 to 1.5 liter urine that is formed per day. Normal value of urine is nothing but the 1000 to 1.5 thousand, sorry, 1000 ml to 1.5 thousand ml per day. So that means 1 liter to 1.5 liter per day. So water is excreted mainly by kidneys in the form of urine. Water is also excreted in the expired air, is also excreted in the feces, through, and also excreted in the skin, also excreted through skin by sweat. So there are different organs for excretion of water. Kidney. Okay. So kidney will excrete water in the form of urine. Lungs will excrete water in the form of expired air. Then your intestine will excrete the water in the form of feces. Skin will excrete the water in the form of sweat. But most of the water is excreted by kidney. Remember. Okay. Now minimum urinary output. It is nothing but the minimum urinary output is nothing but the smallest volume of urine that is required to be excreted by body for the excretion of waste product, and it is about 500 ml per day. Minimum 500 ml per day urine आपको pass करना ही होगा. So that is the minimum urinary output to remove the excretory waste product. Okay. Now excess of urine is controlled by one hormone known as antidiuretic hormone. So excess urine formation is controlled by antidiuretic hormone. Okay. So osmoreceptor, they are responsible for the detection of osmotic pressure of blood. तो जैसे ऑस्मोटिक प्रेशर अब जो है ब्लड का, अगर मान लीजिए कि ऑस्मोटिक प्रेशर ज्यादा हो गया, तो ऑस्मो रिसेप्टर विल बी एक्टिवेटेड एंड दे विल सिग्नल द ब्रेन टू डिक्रीज द रिलीज ऑफ एंटी डायरेटिक हार्मोन. ऑस्मो, ठीक है, ऑस्मोटिक प्रेशर क्यों कब बढ़ता है? जब उसमें सॉल्ट कंटेंट ज्यादा होगा ब्लड में तो ऑस्मोटिक प्रेशर बढ़ेगा, तो एंटी डायरेटिक हार्मोन का सिक्रेशन कम होगा. जैसे ही ऑस्मोटिक प्रेशर ब्लड का कम होगा, एंटी डायरेटिक हार्मोन का सिक्रेशन बढ़ेगा. ओके, एंड वाइस वर्सा. Remember. Now, what are the hormones affecting on the selective reabsorption of What are the hormones affecting the selective reabsorption, okay, in the urine formation. So first, parathyroid hormone, which is secreted by thyroid gland, regulates the reabsorption of calcium and phosphate. So यहाँ पे याद रखो, parathyroid hormone from thyroid gland that regulate the reabsorption of calcium and phosphate in the distal convoluted tubule. तो इसके ऊपर भी क्वेश्चन आ सकता है. Now antidiuretic hormone, as the name indicates, antidiuretic means they will prevent the diuresis or excessive urine formation, and it is also known as a vasopressin. याद रखो, antidiuretic hormone is also known as a vasopressin. Okay. Now it is secreted. This is hormone secreted by posterior lobe of pituitary. Okay. Remember, hormones affecting the selective reabsorption process of urine formation. So parathyroid hormone produced by thyroid gland is responsible for, or it regulates the reabsorption of calcium and phosphate. Antidiuretic hormone is also known as vasopressin, and it is secreted by posterior lobe of pituitary gland, and it increases the permeability at the distal convoluted tubule and collecting tubules, and it increases the water reabsorption. Secretion is regulated by negative feedback mechanism. So antidiuretic hormone मतलब vasopressin responsible for the prevention of diuresis. Anti मतलब opposite, diuresis. Okay, antidiuretic hormone तो ये क्या करेगा, सोडियम वाटर रिटेंशन करेगा, ब्लड वॉल्यूम बढ़ाएगा. ओके, so excessive secretion of antidiuretic hormone will increase the blood volume. Now again, selective reabsorption is affected by aldosterone. So aldosterone is again a hormone secreted by anterior. It is aldosterone is again a hormone secreted by, it is secreted by adrenal cortex, and it increases the sodium and water retention and excretion of potassium. Hormone secretion is again regulated by negative feedback mechanism. Another hormone is there known as atrial natriuretic peptide. Atrial natriuretic peptide. So atrial natriuretic peptide is secreted by atrium of your heart, and it is secreted when there is a stretching of atrial wall, and there is a okay, when there is an excessive amount of blood in the atrium. When there is an excessive amount of blood in the atrium, that causes stretching of your atrial wall, and that leads to secretion of this atrial natriuretic peptide. And what is the function of this peptide? It causes the diuresis. It causes decrease in the sodium and water reabsorption from proximal convoluted tubule, and it decreases the volume of blood. Okay, we have seen this atrial natriuretic peptide regarding this in the in that chapter when we was discussing about the drug treatment of congestive cardiac failure. Okay, so atrial natriuretic peptide क्या है? एक पेप्टाइड है, ये सीक्रेट होता है कहाँ से? एट्रियम में. एट्रियम जो है आपके हार्ट का, वहां से सीक्रेट होता है. कब से सीक्रेट होता है? जब आपके हार्ट में ब्लड का वॉल्यूम ज्यादा हो जाएगा तो आपका एट्रिया में स्ट्रेचिंग आ जाएगा, और वो स्ट्रेचिंग स्टिमुलेट करता है टू रिलीज द एट्रियल नाट्रियोटिक पेप्टाइड. उसका काम क्या है? इट इज अ डायूरेटिक इन नेचर एंड इट इज अ वैसोडाइलेटर. तो ये क्या करेगा? डायूरेसिस करेगा और ब्लड वेसल को डायलेट कर देगा, एट्रियम को भी थोड़ा सा रिलैक्स कर देगा. ओके, सो regarding this we have seen in the drug treatment of congestive cardiac failure, and this is again regulated by release of all these hormone, antidiuretic hormone, aldosterone and atrial natriuretic peptide is regulated by negative feedback mechanism. Okay, now you can see over here again. So when there is a low blood pressure, when there is a low extracellular fluid volume, when there is a sympathetic stimulation, and when there is a low plasma sodium. When there is a low blood pressure, when there is a low extracellular fluid, when there is a stimulation of sympathetic nervous system, when there is a low plasma sodium, that stimulate the release of one hormone from kidney, that is known as renin. So stimuli for renin secretion. Now renin is secreted by this particular special cells present in the kidney known as a juxtaglomerular cells, juxtaglomerular apparatus. This was again a question. Renin is a hormone produced in the kidney by juxtaglomerular cells. Remember this. Okay, now this renin is released, or renin is secreted upon these stimulus: low blood pressure, low extracellular volume, okay, extracellular fluid volume, sympathetic stimulation, and low plasma sodium. that stimulate the extraglomerular cells of kidney to release the renin. Now, what is the renin? Renin is a hormone which will convert angiotensinogen, which is a inactive glycopeptide already present in your plasma, that will be converted to angiotensin 1 by renin. Now this angiotensin 1 is converted into angiotensin 2. Now angiotensin 1 will go into the lungs, and in the lungs angiotensin 1 will be converted into angiotensin 2 by one enzyme known as a angiotensin converting enzyme. So angiotensin converting enzyme क्या करेगा, angiotensin 1 को angiotensin 2 में करेगा. ओके, angiotensin का कन्वर्जन फिर से angiotensin 3 में होता है by enzyme angiotensinase, and then angiotensin third will be converted to angiotensin 4. तो यहाँ पे इसके ऊपर क्वेश्चन आ सकता है कि renin is secreted by juxtaglomerular appetition. What is the stimuli? What is the stimuli upon which it is secreted? Low blood pressure, low extracellular volume fluid, sympathetic stimulation, and low plasma sodium. Okay. Now again remember, this angiotensin 1 is a, it is known as a decapeptide. angiotensin 1 जो है उसको decapeptide बोलते हैं, because angiotensin 1 is a peptide of 10 amino acid, so it is a decapeptide. angiotensin 2 is a octapeptide. Okay, it is a octapeptide. then angiotensin 3 is a it is a heptapeptide. so इसके ऊपर क्वेश्चन आ चुके हैं. angiotensin 1 क्या है, डेकापेप्टाइड. angiotensin 2 क्या है, ऑक्टापेप्टाइड. angiotensin 3 क्या है, हेप्टापेप्टाइड. तो इसके ऊपर भी क्वेश्चन आ चुके हैं. नाउ द angiotensin 2 is a vasopressor. it will increase the it will cause the constriction of blood vessel, and it will regulate the glomerular filtration rate. It will increase the blood pressure, it will increase the water intake, it will increase the antidiuretic hormone secretion, it will increase the secretion of this adrenocorticotropic hormone. then angiotensin third जो है, that will increase the aldosterone secretion, and it also causes the vasoconstriction. Okay, so angiotensin 2 is the most potent vasoconstrictor. याद रखो. angiotensin third जो है, that will stimulate the release of aldosterone and also cause the vasoconstriction. so ये जो angiotensin 2 3 है, वो क्या करेंगे, एक साइड पे ब्लड प्रेशर बढ़ाएंगे और एक साइड पे ब्लड का वॉल्यूम भी बढ़ाएंगे. all these things are very important when you are studying drug treatment of hypertension. We have already seen that in the when we were discussing about the antihypertensive drug at that time also. Okay, now you can see over here again next point. so we have seen there are different parts of your urinary system. Two kidneys are there. Okay, two ureters are there, one urinary bladder and one ureter. so what are the ureter are nothing but they are just like a tubing. Okay, so it is a 25 to 30 centimeter long tube, 3 mm in the diameter. and what is the function of ureter? To transport urine formed from kidney to the bladder. so it is a function of ureter. again it is made up of a 3-layer structure. outer structure is a fibrous tissue, middle one is known as a muscular layer, and inner one is known as a mucosal layer. Okay, and mucosal layer is composed of a transitional epithelium or cuboidal epithelium. the function of this ureter is nothing but the transport of urine from kidney to a bladder by peristaltic movement, known as urinary peristalsis, by rhythmic contraction of smooth muscle. that peristalsis originates from pacemaker, renal pacemaker, known as a minor calysis. Okay, we have seen this peristalsis occurs in the several times per minute. now next part is the urinary bladder. so urinary bladder is a temporary, it collects the urine temporary and stores. so it is a storage and okay, it is a temporary storage and collection of urine. so urinary bladder, so it causes collection of and temporary storage of urine. it is a pear shaped and may become oval during the filling of urine. तो ये pear shaped organ होता है और बाद में उसका oval और round भी बन जाता है जब उसमें urine fill होता है. now it is composed of again 3 layers. outer connective tissue, then outer connective tissue containing nerves and covered with the peritoneum. muscular layer is also known as a detrusor muscle. so muscular layer जो होता है urinary bladder का, उसमें detrusor muscle होता है, detrusor muscle. इसके ऊपर भी क्वेश्चन आ चुका है. so remember, so in case of urinary bladder, the smooth muscle layer is nothing but the detrusor muscle, and when this muscle contract, there is a emptying of blood. Okay, now last part of your urinary system is the urethra. So what is the function of urethra? It will pass the urine from urinary bladder to exterior. Now remember, male urethra is longer than female. जो मेल्स होते हैं उनका यूरेथ्रा थोड़ा सा लंबा होता है और फीमेल्स में यूरेथ्रा शॉर्ट होता है. दैट्स व्हाई फीमेल्स आर मोर प्रोन टू यूरिनरी ट्रैक्ट इन्फेक्शन देन मेल्स. मेल्स में क्या होता है कि लंबा यूरेथ्रा होने के कारण बैक्टीरिया का इन्फेक्शन जल्दी नहीं जाता, और फीमेल्स में क्या है कि यूरेथ्रा छोटा होने के कारण उसमें इन्फेक्शन जल्दी हो जाता है. So females are more prone to urethral infection, urinary tract infection. Now this urethra is supplied with two kind of sphincter. First one is known as internal sphincter, which is involuntary in nature, and second one is external sphincter, which is voluntary in nature. Okay, तो यहाँ पे क्या है कि यूरेथ्रा में दो स्पिंक्टर्स होते हैं. स्पिंक्टर्स मतलब गेट. अगेन इट इज अ स्मूथ मसल. ओके, सो जो इंटरनल स्पिंक्टर होता है वो इनवॉलंटरी होता है, आपके कंट्रोल में नहीं होता, और जो एक्सटर्नल स्पिंक्टर होता है वो वॉलंटरी होता है, वो कंट्रोल में होता है. कि आपको अगर यूरिनेशन का सेंस आया तो आप एक 5 या 10 मिनट तक होल्ड कर सकते हो, 15 मिनट तक होल्ड कर सकते हो, डिपेंडिंग अपॉन द कैपेसिटी ऑफ इंडिविजुअल, बिकॉज दैट एक्सटर्नल स्पिंक्टर इज इन अ वॉलंटरी कंट्रोल. लेकिन क्या होता है कि व्हेन यू आर अ चाइल्ड, जो बच्चे होते हैं, चिल्ड्रंस होते हैं, उनमें क्या होता है कि बोथ इंटरनल स्पिंक्टर एज वेल एज एक्सटर्नल स्पिंक्टर बोथ आर इनवॉलंटरी. तो बच्चों में दोनों में स्पिंक्टर क्या है, इनवॉलंटरी होते हैं, एंड उसकी वजह से क्या होता है, बच्चे कहाँ पे भी सुसु कर देते हैं. सो चिल्ड्रंस कैन पास यूरिन एनीवेयर बिकॉज इट इज नॉट इन देयर कंट्रोल. एंड व्हेन द चिल्ड्रंस विल बिकम एट द एज ऑफ योर 6 years 5 years 6 years, तो कभी कभी 4-5 साल का बच्चा हो गया तो उसमें क्या होता है कि एक्सटर्नल स्पिंक्टर जो इनवॉलंटरी था वो वॉलंटरी बन जाता है, and now it can control, it can have sense. Okay, now remember 300 to 400 ml urine collection in the bladder that will stimulate the autonomic nerve fiber and spinal reflex in the infants of the bladder for micturition. Micturition means passing of urine or voiding. Okay, so these are the parts of urinary system. Now we'll see the different signs and symptoms of urinary disorders of urinary system. So first one is nothing but the oligouria. Oligouria means, oligo means come, urea means urine. So if there is a less urine output than 400 ml per day, known as oligouria. Next one is a hematouria. Hematouria means presence of blood cells in the urine, and that is due to different reasons like glomerulonephritis, okay, or occasionally filtration of RBC in the glomerulus, or sometimes because of the bleeding in the urinary tract. So hematouria, presence of blood in the urine. Now proteinuria, presence of protein in the urine. Appearance of protein in the urine due to abnormal filtration of plasma proteins. Okay, anuria means absence of urine. If you are not able to produce urine, that is known as anuria. Dysuria means pain during urination, usually burning type of sensation during the passing of urine. जब आप यूरिन पास करते हो आपको एकदम पूरा जलन होती है, उसको बोलते हैं डिस्यूरिया. नाउ ग्लोमेरुलोनेफ्राइटिस मींस इन्फ्लेमेशन ऑफ ग्लोमेरुलस. ओके, इन्फ्लेमेशन ऑफ ग्लोमेरुलस ऑफ सेवरल टाइप्स. समटाइम्स इट इज ड्यू टू ऑटोइम्यून रिएक्शन नोन एज एंटीजन एंटीबॉडी. ओके, जैसे इसमें क्या होता है कि कभी कभी आपकी खुद की बॉडी के सेल ही एज ए एंटीजन ट्रीट करते हैं और उसके अगेंस्ट में एंटीबॉडी बनाते हैं, तो एंटीजन एंटीबॉडी रिएक्शन होता है और उससे वजह से इन्फ्लेमेशन होता है नोन एज ग्लोमेरुलोनेफ्राइटिस. तो यही एक ही रीजन नहीं है, देयर आर सेवरल रीजंस. There are several reasons for glomerulonephritis. So your own cell will act as antigen, against that antibody will be produced, and antigen antibody reaction may cause glomerulonephritis. Or glomerulonephritis may be caused because of the infection and all that. Okay, effects of glomerulonephritis. So it can lead to hematouria, asymptomatic proteinuria, acute nephritis, oligouria, hypertension, and hematouria. Nephrotic syndrome is because of the several kidney disease characterized by generalized edema, hypoalbuminemia, and hypolipidemia. Diabetic nephropathy is another disease. It is caused by several hypertension, cardiovascular, long-term hypoglycemia, hypoglycemia or damage to the blood vessels or kidney. Then kidney stones means what? Formation of crystals of calcium oxalate in the kidney. What is the role of kidney? To remove the excess acid formed in the body. So that acid sometimes combines with the ions like calcium and sodium to form calcium oxalate crystal. That crystal get deposited in the urine, a urinary system like kidney, ureter or bladder, known as stones. Acute tubular necrosis due to ischemia, cardiovascular shock, dehydration, hemorrhage, trauma, excessive bone, then myocardial infarction and complex surgery. Okay, it needs a surgery. Okay, acute tubular necrosis. आपके जो tubules है उसका necrosis हो जाएगा. Now again, next term is glycosuria. Glycosuria means presence of sugar. Glycosuria means presence of sugar in the urine. Okay, and that occurs in the diabetes mellitus. Ketonuria means presence of ketone bodies in the urine. That occurs due to starvation. अगर आपको बहुत दिन तक खाना नहीं मिला तो starvation हो जाएगा और ketone bodies बन जाएगी. That will be excreted in the urine. So ketonuria means presence of ketone bodies in the urine. Polyuria means large amount of urine formation. Then nocturia means involuntary passing the urine in the night. कि रात में ही बेड पे सुसु कर देना उसको बोलते हैं nocturia. Incontinence means involuntary loss of urine. Frequency of urine micturition means requiring to pass small amount of urine frequently. मतलब अगर नॉर्मली क्या होता है कि 300-400 ml यूरिन बन गया आपके यूरिनरी ब्लैडर में कलेक्शन हो गया तब आप यूरिन पास करते हो. लेकिन कभी कभी क्या होता है कि इंक्रीज द फ्रीक्वेंसी ऑफ यूरिनेशन मतलब अगर आपकी इसमें 50 ml 100 ml भी यूरिन फॉर्म हुआ है अगर आपको उसका सेंस आ गया तो उसको बोलते हैं फ्रीक्वेंसी ऑफ यूरिनेशन. फॉर दैट टू रिड्यूस द फ्रीक्वेंसी ऑफ यूरिनेशन सोलिफिनेसिन इज द ड्रग. ओके, वी हैव सीन ऑलरेडी. नाउ नेक्स्ट ड्रग इज अ ड्रग कॉजिंग एक्यूट ट्यूबुलर नेक्रोसिस. तो ये ड्रग नेक्रोसिस करते हैं आपके ट्यूबल्स को डैमेज करते हैं रिनल ट्यूबल्स. अमीनोग्लाइकोसाइड एनएसआईडी एस इनहिबिटर्स लिथियम पैरास्टामोल. तो आपने सुना होगा कि जो पेन किलर्स होते हैं वो किडनी डैमेज करते हैं. दैट इज बिकॉज ऑफ दिस बिकॉज दिस ड्रग कॉजेस ट्यूबुलर नेक्रोसिस. Chronic renal failure, chronic renal failure is another disease known as if reversible. There is a irreversible damage to a nephron and is about 75%. There is a great reduction in the glomerular GFR. That is nothing but the chronic renal failure. अगर आपका ग्लोमेरुलस को या फिर नेफ्रॉन को डैमेज हो गया तो आपका GFR कम हो जाएगा. उसको बोलते हैं chronic renal failure. Now next one is genetic abnormality of kidney. तो नॉर्मली किडनी कितना होता है? 2 होता है. लेकिन कभी कभी एबनॉर्मल किडनी बन जाते हैं. 3 किडनी 4 किडनी. दैट इज नोन एज अ मिसप्लेस्ड और इक्टोपिक किडनी और पॉलीसिस्टिक डिसीज. ऑटोसोमल डोमिनेंट पॉलीसिस्टिक किडनी डिसीज. नाउ ट्यूमर्स ऑफ किडनी. अगर आपके किडनी में कोई ट्यूमर हो गया तो उसको बोलेंगे ट्यूमर्स ऑफ किडनी. मैलिग्नेंट